Hello everyone, myself Dr. Prateek Garg. So today we will discuss about atrophic rhinitis. By the name itself suggests there is an atrophy of the nose leading to the inflammation process in the nose. So atrophic rhinitis is basically an inflammation going into the nose which is causing the atrophy of the nasal structures. It is also known as ozania. Okay. So, what are the causes? See, the most common cause of the atrophic rhinitis is considered idiopathic. So, there is no cause found. Then, what are the other causes? There may be the hereditary factor, and one other thing which is being noted in the recent year is the estrogen deficiency or vitamin A or vitamin D deficiency. See, vitamin D and vitamin A, these all are very essential in the body, and it has been proved that vitamin D deficiency will lead to the immunodeficiency or the immunocompromised state. So maybe because of this vitamin A and D deficiency, the patient may have some sort of immunocompromise leading to the atrophic rhinitis. And estrogen also play an important role. If it is deficient, then the chances of atrophic rhinitis increases. Then one of the infection of the bacteria found, which is known as Klebsiella ozoniae. So this is the bacteria which is mainly found in the patient of the atrophic rhinitis, leading to more and more atrophy of the nasal structure. And then any surgery which causes extreme destruction. Suppose we are treating the mucormycosis or black fungus which is being seen in this corona period. So excessive destructive surgery which involves the removal of major nasal structures may also lead to the atrophic rhinitis. And TB, syphilis or SLE, these also may aggravate the atrophic rhinitis process. What is the pathology, or we can say pathophysiology? We all know that in nasal cavity it is consists of pseudostratified ciliated columnar epithelium. In our respiratory system, what is the epithelium which is there? It is pseudostratified ciliated columnar. If there is a metaplasia, that is that pseudostratified epithelium changes to the stratified squamous epithelium. So this stratified squamous epithelium, if it is being present in the respiratory pathway, so that will lead to the atrophic rhinitis, or this is a pathology we have seen. We have taken the biopsy in the atrophic rhinitis patient. So generally mucosa is being changed to the stratified squamous epithelium. Now try to remember the ear case. We all know about cholesteatoma. What is cholesteatoma? Cholesteatoma is nothing but the presence of stratified squamous epithelium in a wrong place, that is in the middle ear. So if by any chance this stratified squamous epithelium is present at a wrong side, what will this epithelium do? This will just try to eat up all the structures. That's what it is doing in the ear by means of cholesteatoma. Same thing it is doing in the nose by means of atrophic rhinitis. So what happens in this atrophic rhinitis? All the mucosa, all the nerves, all the vessels, everything get atrophied. That is, there is slowly destruction of the mucosa, the cilia, the nerves or the vessels. It will lead to atrophy, and that will also lead to loss of sensory nerves. Why this is important? Because there will be no sensation perceived by the patient. So what will happen? Any trauma, patient will not have any sensation. Any collection of the crusting or the pus in the nose, patient, because of loss of the sensory nerve, patient himself can't feel what's going on inside the nose. So one condition is present which is known as merciful anosmia. That means patient is having very bad breath, patient is having foul smell in the nose, but patient himself can't feel that bad smell. So he's comfortable, but the surrounding person in front of him, they are very uncomfortable because of that smell. Now what happens in this atrophic rhinitis? There is excessive crusting, and this crusting plus the loss of the sensory nerve, then all will lead to the nasal obstruction. So what will the patient complain? Patient will complain of nasal obstruction. If we look out, try to look in the nose by means of the nasal endoscopy, what we can see? We can see that there is very large gap So look at this diagram. So generally the nasal cavity is roomy. So space is there because there will be the turbinate shrinkage, there will be the loss of the mucosa. So nasal cavity will be broader, but still patient will have a sensation of nasal blockage. Why the sensation is there? Firstly, there is loss of sensory nerve, and secondly, there is a presence of crusting. You can see this pus. So this crusting, the loss of sensory nerves, this all will lead to the sensation of nasal blockage. And the condition which we have discussed already is known as merciful anosmia, where patient is unaware of this foul-smelling nasal discharge. Now, what is the treatment? The first treatment is remove the crust, remove all the pus, all the crusting, all the dried scab present in the nose. Then comes a nasal alkaline douche. So what is this nasal alkaline douche? It is generally being prepared by mixing in the ratio 2:1:1. So sodium chloride is in 2 parts, then comes sodium bicarbonate and sodium biborate. These are all 1:1 part. So 2:1:1, sodium chloride, sodium bicarbonate and sodium biborate, and mix all these three into 280 ml of the distilled water, and this will form the nasal alkaline douche. So what we have to do, we have to just push or irrigate the nose by this mixture. So what will do, this mixture will remove all the crusting. This mixture will also act as a bactericidal, and this will clean out the nasal cavity. Any collection of the discharge or pus will get removed, and there will be some nourishment to the nasal mucosa. What are the other treatment? One is the Camectin solution. So it has been marked by the COPD, short form. You can remember by COPD. So what I mean by C? It is a Camectin solution. It is made up of C stand for chloramphenicol, which is an antibiotic. O stand for estrogen. We know the estrogen deficiency will cause the atrophic rhinitis. That is a contributing factor. So O stand for estradiol, or we can say estrogen. P stand for propylene glycol, which is a hygroscopic agent. So P stand for propylene glycol, and D stand for vitamin D. So Camectin solution, which is made up of antibiotic, chloramphenicol, then comes the estrogen, then comes the vitamin D and propylene glycol, which are, we know the vitamin D deficiency also causes the atrophic rhinitis. So this COPD combination will also help in healing of the atrophic rhinitis, or helpful in treating the patient of atrophic rhinitis. Then what are other method? We can also use submucosal placental extract. If we inject this placental extract into submucosa, so that will allow the healing process, that will downgrade this atrophic rhinitis process. So what will it do? It will increase the blood supply to the mucosa, leading to hypertrophy, again the hypertrophy of the mucosa. Then other methods are potassium iodide solution. What it causes? It increases the nasal secretion. Then comes the 25% glucose in glycerin. So again, 25% glucose in glycerin is very effective in treating the atrophic rhinitis. How it helps? So this is particularly a hygroscopic agent. Firstly, 25% glucose. Again, this is also bactericidal. It will kill out the bacteria which are being present in the atrophic rhinitis, like the Klebsiella ozonae. And this glycerin will act as a lubricant. Okay. So again, this is very helpful. Now, what are the surgery which are being performed in the patient of atrophic rhinitis? First is the Young operation, then comes the modified Young operation. So what is the difference? See, what we do in Young operation, we just took out a mucopericordial flap in the nose, and we will just block this nasal opening. So in Young operation, we will completely block this nasal opening, whereas in modified Young operation, we will just leave a 3 mm hole, and rest of the nasal opening will be closed by means of mucopericordial flap. So this is known as Young operation, being discovered by the scientist named as Young. And we have seen that after a closure of 3 months to 6 months, the nasal cavity again become normal. Third operation is Lawton-Slager operation. Again, this has been asked in the exam in past years, given in the options. So try to remember all these 3 surgical names. So I hope you got a basic idea about atrophic rhinitis.